only COVID update on Facebook for the week, as the agency is closed on Thursday and Friday to allow our employees to spend time with their families over the Thanksgiving holiday. So to give you the update on the global picture of COVID-19, nearly 59 million cases of COVID-19 with 1.4 million deaths globally. In the United States, 12.3 million cases of COVID-19 with just over 257,000 deaths. In Alabama today, they're reporting 234 and 80 cases of COVID-19, so just over 234,000 cases with almost 3,500 deaths. In Mobile County, our daily report that is produced in collaboration with SSI Group here in Mobile, we're reporting on 19,408 cases of COVID-19. Yesterday, Sunday the 22nd, 47 cases were reported. On Saturday, 70 cases were reported. And on Friday, 104 cases of COVID-19 were reported. Today, we reported 361 deaths. That's an increase of 2 since yesterday. A cumulative number hospitalized with COVID-19 as 2,532. That's an increase of 6. And the daily number of people hospitalized in Mobile hospitals with COVID-19 yesterday was 103. That was a slight increase over the day before, but notable because late last week we had dropped down into the high 80s with the number of people hospitalized, and we are back up into the 100s. And I just want to emphasize, in Mobile County, in the state of Alabama, and nationwide, we are seeing the number of COVID cases going up, seeing the number of hospitalizations going up, and seeing the number of deaths going up. This is extremely concerning to all of us in public health, and it should be to you as well. In fact, CDC has come out with a recommendation against traveling for the Thanksgiving holiday because these are some of the highest numbers of cases, just a record number of cases reported daily, something like 150,000 or so reported daily in the United States. So no matter where you're going, if you're planning to travel, there is widespread community transmission of COVID-19 in our population right now, so you are safer at home. To give you a couple of more just tidbits on the data, our weekly expanded report is not available today. The complete report will be available tomorrow, but just a couple highlights. Last week, 767 COVID-19 cases were reported. That was an increase of just a few over the prior week. So last week, 767, a slight increase in the number of cases reported the 7 days prior to that. The number of deaths, the date of deaths, people who died last week was slightly lower, but still we've been seeing overall an increasing trend in the number of people who have died. We know that there's some work going on at the state going back to look at death certificates that have been processed where COVID-19 is not listed as the primary cause of death, but there's some cross-referencing going on to determine if they are not confirmed COVID deaths, but perhaps probable COVID deaths, where they may have died within 30 days of receiving a COVID diagnosis, and those will be reclassified and the date of death entered. And again, those will pop up as they're reported, but then we will adjust and plot them according to the date that they died so that we can see what the real picture looks like. Just to mention, when we say, Dr. Harris talked about this on his live Facebook update today, that anywhere from 1.5 to 2% of the population who have been diagnosed with COVID had died, which seems like a very small number. Of course, it's much, much, much higher than that in older people. But even if it were just spread across the population, it means a town or a county the size of Mobile, we would see, upwards of 6,200 deaths based on our population size with that low a death rate, which means that, 3,700 more people will die of COVID if we don't implement public health measures and try to mitigate and slow the spread. Also, I've talked recently about the number of hospital beds available. In general, right now we're seeing on a daily basis around 100 people hospitalized on any given day with COVID. That's about half the number we saw during the peak hospitalizations in mid to late July. So we know that our hospitals can adapt and increase the number of COVID beds and ICU beds if they need to. But when I checked this morning, yesterday, there were 7 ICU beds available. So again, our hospitals can adapt quickly and can expand to have more beds, but we really want to keep COVID transmission down so that we can protect those that are most vulnerable from severe complications that might require hospitalizations. So we don't want to overwhelm our healthcare system and our hospitals. Let's see. We have outbreaks, as I've mentioned before, in long-term care facilities, in shelters, in assisted living, in nursing homes, in schools, in medical offices. Just, they're popping up all over the place. This, again, is a sign that COVID transmission right now is really high in our community. And then we are also continuing to do consultations with pool companies, with hair salons, with schools, like I said, with medical groups, with hotels, with dentist offices, with workplaces, with churches, with first responders, all trying to, when they detect a case, trying to keep COVID out of their facility. And if they have workers or residents that are COVID positive, we're consulting with them to help them slow the spread. So I think with that, I'm going to stop for a moment. We have some questions to take and some discussion about Thanksgiving, but our Executive Director of Family Health, Ms. Kelly Warren, is here to give you a report of our outreach on Saturday, Know Before You Go. So stay tuned for Kelly in just a second here.
Hi everyone, good afternoon. My name is Kelly Warren. I'm Executive Director for Family Health here at the Health Department. And just wanted to thank everyone for coming out to participate in the Know Before You Go campaign and mass testing that we had this past Saturday. It was a really great event. We had some hiccups. We had a much larger turnout than we had initially planned for efficiently. So if you were one of those folks waiting in your car and waiting a long time in some cases, we appreciate you for hanging in there with us and staying and getting tested. We hope if you were not able to get tested that you'll feel free to call our 690-8889 phone number in order to schedule some testing at any of our sites Monday through Friday. We were happy to have 889 individuals come through our test sites throughout this Saturday. We had 32 positives overall, and so we thought it was a great event. We were happy to be a part of giving folks the information that they need in order to make a good choice for themselves and how they celebrate the Thanksgiving holiday. So we just hope folks will stay home if they're experiencing any symptoms, avoid gathering in large crowds this year, make good plans for celebrations next year that are more what you're used to, and just continue to be vigilant with wearing your mask, practicing social distancing, washing your hands, and just follow all those safer socializing recommendations that we've made throughout this pandemic leading up to now. So again, thank you so much for all your participation, for promotion of the Know Before You Go event, and we look forward to having more of these as we progress through the holiday season, and we'll be making improvements to those as we get those scheduled. So thank you, be safe, and happy holidays.
You answered these though, right? Oh, okay. Sorry, Kelly and I are trying to get our act together here in our co-hosting duties. Okay, let's see. I'll answer, we had a lot of questions from the media today and a few from Facebook. So let me get started with the ones from the media. I have Kelly's answers here as well. So let me just get that in front of me. Sorry. So a question about concerns that public health professionals have around large gatherings, things like parades, sporting events, tailgating, parties, Thanksgiving dinners, anything where you're going to be around people who don't live with you, we have the same recommendation. So it is quite concerning when large gatherings occur because that increases your risk of COVID transmission. So anytime, if you're at a tree lighting, if you're at a parade, if you are at a sporting event, or anything where you are around people who do not live with you, it raises your risk of COVID transmission. You're more likely to get infected during those kinds of events. So the best thing to do is stay at home. If you're going to go out and you cannot maintain 6 feet of distance between anyone that doesn't live with you, you should wear a mask. You should wash your hands frequently. You should disinfect high-touch surfaces. You should stay at home if you're sick or if you've been around someone who was sick. And again, you must maintain that 6-foot distance. These are, and also remember that large gatherings that cannot facilitate 6 feet of distance are prohibited under the current Safer at Home order that expires on December 11th. So, the changes in the order, yes, lifted restrictions on things like limiting occupancy, limiting the number of shoppers, limiting the number of diners, limiting the number on gatherings. Those things were removed from the Safer at Home order. But any non-work gathering that cannot promote or facilitate 6 feet distance between people who do not live together are still prohibited. We've been hearing about across the state. I heard last week from ADPH that about 30 restaurants have been issued closure notices because they've not been able to comply with the state health order. All right, another question about Black Friday, about shopping. Many online stores are already offering Black Friday deals, and this is the safest way to get your Black Friday shopping in. Get it early, get the same deal. You don't even have to get up at the crack of dawn anymore, right? You can do it all online. So again, we want to make sure that retailers are requiring masks for all of their employees and then encouraging masks for all of their customers. Let's see. I think Kelly's already talked about the Know Before You Go event. That Mobile County Health Department, through 6 of its locations, tested 889 people on Saturday. We're really excited about that. And 32 of them were positive. So 32 people know that they should not travel for the next 10 days. They should remain at home. It's interesting. This sample, this 889 sample is not a, random, unbiased sample of the population. What we scientists call it is a convenience sample. But with 32 being positive, that tells us that about 3.6% of that group, that sample, was positive. So if you think about it, if you are going to a gathering that has 100 people in it, from 3 to 4 people that are in that crowd are probably asymptomatic, infectious with COVID. So if you have just 50, then 1 to 2 in that group may be asymptomatic and unknowingly infectious and spreading COVID to others. So this is a clear and present danger, and the larger the gathering, the higher the risk. So keep your gatherings small if you must have them. Try to have them outside if you must, and limit the time. So shorter is better, fewer people is better, and outside is better. Someone asking if we know about outbreaks at nursing homes. Yes, we know that there are outbreaks at nursing homes and assisted living facilities and other congregate settings, and we've been working with many of those, probably 6 or 8, to try to help them identify, control the outbreak, and stop the spread in their facility. Someone asking about what rate of hospitalization would cause concern. I'm concerned about the number of hospitalizations now because it's been going up and up and up every week. So we're back up to, on average, in the hundreds each day hospitalized with COVID. That is a big concern to me. There is not a set threshold. Let's see. Some other questions about our weekend testing event. Someone asking, let's see, hundreds showed up. Is it concerning to see many people are potentially traveling home? So not everybody that showed up got tested because they're traveling home, or some just were curious to know if they're positive, and that's fine. We're happy to test them too. But if you are traveling, you have to continue to be hyper vigilant about decreasing the likelihood of asymptomatic spread. So again, if you are going to congregate, do it outdoors, wear your mask, practice social distancing, wash your hands, follow the recommendations, and under what we call safer socializing, like using disposable plates, cups, napkins, utensils. Have one person serve the food. Don't have buffets. Anyone who is sick with COVID or who has been exposed to COVID needs to stay home. And then there was a question about the test being rapid test results. So yeah, the test that we provided on Saturday is a rapid test. So people got their result while they waited. And if you get tested at another facility that you don't get test results immediately, you need to stay home until you get your test result, right? We don't want you to test and then start traveling and then find out in the middle of travel that you've got COVID. So get tested, stay at home until you get your test result. And remember, even if you get a negative test result today, that doesn't mean you're not going to be shedding virus in 2 days. So it still means you have to wear a mask and keep your distance from people who don't live with you. It just helps give you some information. If you are positive, you definitely need to stay at home. Let's see. As the media asking if we plan to do another weekend of free testing, we have been discussing it, potentially the days before Christmas, perhaps, or maybe the weekend before Christmas. But as you can imagine, this is a really large, it takes a lot of resources to operate 6 free COVID testing locations. So we'll consider those things. But yes, it was a great success. And also depends on if we have free test kits available to us. But remember, you can get tested at any of our Mobile County Health Department locations Monday through Friday for free, no cost to you. You don't have to be symptomatic. Anybody who wants a test can get a test by calling 690-8889. Again, 690-8889. Please get tested. Let's see. Some folks were asking about the accuracy of the test that we used over the weekend. This is called the Binax Now antigen card. It is an antigen test. It is not a PCR test, so it's not quite as accurate as a PCR test, but getting test result back in 30 minutes has lots of advantages over a PCR test that can take a couple of days sometimes. But the Binax Now antigen card has positive agreement with PCR 97.1% of the time, and negative agreement with PCR 98.5% of the time. All right. Let's see. Someone asking about Dr. Eichel's public health notice, reminding people that we are classified on Friday. We were our risk indicator moved to high risk. You know, how alarming is this, and why should people pay attention to it? Again, all indicators are going in the wrong direction. Everything. Our risk indicator dashboard is going up. Cases are going up. Hospitalizations are going up. Deaths are going up. Outbreaks are on the rise. Kids in schools are cases in kids in schools are nearly doubling every week. So all of these things point to widespread community transmission that can only be controlled right now by mitigation strategies like wearing your mask, staying at home if you're sick, washing your hands. And maintaining that 6 foot of distance. Let's see, a couple questions about the state. Dr. Harris spoke earlier today and talked about his concern and recommending that people do not travel over the Thanksgiving holidays. That's the same recommendation that's coming out of the Centers for Disease Control. But he discussed some of the COVID vaccine plans that are, you see a lot in the news now that there have been some early promising results from the usefulness or the efficacy of a protective vaccine. And right now, we don't know many more things than we do know. What we do know is that early on, the vaccine will require ultra low cold storage, which means that most likely it will be distributed initially to hospitals who are capable of ultra low storage, and hospital staff and first responders and people who are 65 or older will be the first people targeted. But those decisions will likely be made and publicized late next week. So stay tuned for that. We're working really hard with ADPH to try to get all of our hospitals in Mobile County registered in the Imprint application. Imprint is the name of the system that ADPH uses to register people who will be able to order, receive, and administer the vaccine. So anybody who wants to order vaccine, whether it's October 10th or 15th when it might become available, or whether you want to order it in April when maybe there's a lot more available, or next summer sometime, every provider who wants to order, receive, and administer vaccine, no matter how large or small the order, has to do it through Imprint. If you have not signed up yet and you want to, please send me an email to covid19@mchd.org and put Imprint in the subject line. Let's see. So someone also asking about vaccination pointed out that, in Alabama, we're going into our 8th or 9th month of COVID, and we've tested just 1.5 million people, which is about 1/3 the population of the state. And the question was, realistically, how long will it take to vaccinate enough people that the rising cases can be slowed down? And it really depends. Remember, the first few vaccines we expect will be 2-dose vaccines. So you'll have to get 1 dose and then get another dose in about 28 days. And then a week later, you will have protective immunity from that vaccine. So you won't be protected initially, and right now you need 2 doses in order to get full coverage. So it really depends on the sort of efficacy of the vaccine, how protective it is, how much immunity it gives you. But I've seen it published somewhere that the target is maybe to try to get vaccine in around 60% of the population. So this is going to be, once there's a lot of vaccine available, it will be an all vaccinators on deck to try to assist with this. So you'll start seeing, hospitals, pharmacies, lots of different physician offices, maybe even dental offices, lots of things on the table to allow a surge in vaccinators when there is enough vaccine ready. Then someone's asking about, have mobile hospitals received some of the infusion, the monoclonal antibody injectable that Eli Lilly was recently authorized to distribute? And the answer is yes. And I am going to start calling this antibody BAML, because the name of it is BAML, and then ANI for, I think, anti, and then VI maybe for viral, and then MAB for monoclonal antibody, and which creates this word that almost no one can pronounce. So yes, the BAML antibody is in the state, and local hospitals have requested it and received it and are beginning to use it. All right. Someone on Facebook was asking if females are more prone to illness. The answer to that really is no. There's no biology behind, them being more susceptible. What we see with mild disease, uncomplicated disease, is that women are more likely to seek care or treatment than men are. So the Facebook viewer was saying, he thought females tended to be, or she thought females tended to be more cautious and wash hands more frequently, yet we have more females with COVID than males, and I really think that's just more females are likely to seek care and get tested for COVID than males will. Are there increases in one area or several? So we know that there's accelerated transmission, in North Mobile, Saraland, Satsuma, Chickasaw, Citronelle, those areas. This weekend, it's interesting because of the 6 locations the Sims location actually had the highest number of positives. So we may be seeing accelerated transmission out there as well. All right, and then another question about the accuracy of the COVID tests that we ran on Saturday. So I think that addresses, or at least attempts to address, the question. Let me just again remind you that Centers for Disease Control, the Alabama Department of Public Health, State Health Officer, the Mobile County Health Department, and Dr. Eichelt, our health officer, and myself, all recommend that you stay at home for Thanksgiving and you eat with the folks that live with you to slow the spread of COVID in our community. Everyone is really worried about travel during the holidays and medium to large size gatherings over the holidays, that it's going to result in just a horrid December with regard to the number of cases and deaths and hospitalizations. So remember, you are safer at home. I heard on a CDC call today that something like TSA reported 1 million people traveled on Saturday and another 1 million on Sunday. And that, the weekend after Thanksgiving probably will be the largest travel days since COVID began. And none of us want to see a repeat of what happened to us in July following Memorial Day and the lifting of some of the safer at home restrictions. So please stay at home if you can. Limit your gatherings to the fewest number of people as possible. Have them outside to the greatest extent possible. Have shorter lengths of gatherings rather than having lunch and then watching football for 4 or 5 hours, please. Wear your mask. Maintain 6 feet between you and anyone who does not live with you to try to slow the spread. And then if you are going to gather, remember those that are more vulnerable, right? Try to protect those people in your family who are older or who have underlying medical conditions by doing some of those things like, using disposable cutlery and plates and cups, making sure that you disinfect surfaces, require that your family members wear a mask, put the chairs 6 feet apart to begin with, things like that you can do to try to make a gathering safer. But our strong recommendation and reminder is that you are safer at home. So with that, I will stop. Hope that everyone has a restful and safer at home Thanksgiving holiday, and we'll talk to you again next Monday from the Mobile County Health Department.